Since the outbreak of COVID-19 in China and its subsequent spread to other parts of the world, information on preventive measures has been immense. Efforts to scale down the spread of the pandemic has had some countries opting for total shutdown, with Uganda nearly walking to the same direction. Though this has yielded desired results, like in China, where there are reports of a return to normalcy in Wuhan, experts have expressed fears that this might leave many psychologically tortured due to the frustration that come with most of these measures. Nalwoga, not real name, is one of those people that experience morning allergies, a health status that has similar signs and symptoms like those of COVID-19. In the wake of this pandemic, Nalwoga says she's finding hard time to freely mingle with her friends for fear of being misconstrued.
Recently, I was getting on a border as I was getting to work, and I happened to want to sneeze. But then I was wearing a mask, and I was in a crowded place. So because of this coronavirus thing that has been moving around, I got so scared and I couldn't sneeze. I had to try as hard as I could to hold in my sneeze.
Dr. Kabuga Amir, a lecturer of clinical psychology at Lira University, warns that with such misconceptions about the pandemic, if not timely addressed, many might survive COVID-19 but succumb to psychological torture.
Just like when you are told you have HIV and stigmatized, it means the only thing you think about is at least death, or the other people don't like me. You look like a social outcast for that matter. And that one increases the problem. That's why some people, for instance, in the case of HIV, they don't even take their drugs because they don't see reasons why. After all, people don't like them. This can happen in this case. If you are stigmatized, people may decide to hide. By the way, that's why people hide perhaps.
The other danger that Dr. Kabuga points out as regards to the partial shutdown of the country is the sudden change in routines. He warns that though many might physically observe social distancing, it is bound to choke the inner beings. Dr. Kabuga sends a special message to the general public on how best they should relate with those suspected or even confirmed cases of COVID-19.
We need to know such symptoms if we are affected. For instance, you have negative thoughts, you overthink about these problems, like COVID. Every time you think about how it's going to kill you, how it's going to kill your children, how it's going to kill everybody, how it's going to affect you, and you realize that you are paranoid. You are suspecting everybody to be suffering from what? Now it means you've started having signs of what? Now it's better now you talk to the professionals if they are within your vicinity. The professionals, those are trained psychologists. And I'm not talking about the church counselors, I'm not talking about people who have had a 1 week training calling themselves counselors.
He advises on the need for individuals to seek counseling services by psychologists and psychiatrists regularly, though they are few.
Therefore, don't medicate yourself, but also don't stigmatize others who have similar what. You better have a professional advice on the same. And the professional advice can only be given by a trained doctor. Because we are in this kind of situation where we need emergencies, I'm providing my free services.
Available statistics indicate that Uganda has about 35 known psychiatrists handling cases arising from a population of over 47 million people. Dorcas Kimono, UBC TV News.